Hello, everyone. My name is William, and I'm here to share with you what I have learned about preceptorships in nursing. For the sake of understanding training methods, I have a few questions. Are preceptorships more beneficial to nursing staff than traditional training methods? What are the benefits of having a new nurse train under a preceptor? And is it a cost-effective strategy? In comparison to other traditional styles of training, new graduate nurses and returning nurses who receive mentorship style training and orientation will be more competent at their job and more confident and comfortable in their role in the first year after orientation is completed. Also, in a 2021 study, it was found that the mentorship of new nurses can positively impact a new nurse's intent to stay with their hiring unit and improve retention rates. Nurses with a mentor were retained at a 25% higher rate than those without. Hospitals that use preceptorships save money on training as well. Turnover is expensive. The average cost to replace a nurse is $46,000. And incorporating preceptorships will decrease turnover, meaning that facilities will spend a little bit more during the training process, but have less of a chance of having to retrain a replacement down the road. The cost of a turnover is much worse than the cost of paying a preceptor. As of January this year, my place of employment, Overland Park Regional Medical Center, has switched completely over to precepting for students, techs, and RNs. During the pandemic, turnover was much worse than it had been in the past few years. We knew we had to do something, and our chief nurse educator advocated strongly for preceptorships, so we made the change. Traditionally, orientation was consisted of following members of your profession for 2 weeks or less until they feel confident that you can perform tasks independently. Preceptorships are a one-on-one with a trained preceptor who is trained to take you directly under their tutelage and train you for about 6 weeks until you feel comfortable performing independently. If need be, preceptorships are extended to confirm that the preceptee is competent and comfortable in their position. Preceptors were offered the position with a small pay raise incentive while precepting. The training was free and on the job, and unlike orientation periods, the preceptee and preceptor coordinate their schedules so that they are always together during their mentorship. That way, a preceptor personally follows the preceptee and guides their training on a personal level. The preceptorships had the usual kinks to work out, of course, but the benefits were obvious. New nurses completing their preceptorships felt more confident in their new roles. They believed that they could care for patients more safely and independently. On top of that, there were fewer medication errors and mistakes made by new nurses after preceptorship was incorporated. Turnover has decreased on average by about 30% for day shift and 20% for night shift. There were, of course, some challenges to overcome. One big one was instructor fatigue. So some preceptors would admit to being tired of precepting, stating that it takes a lot of focus and patience. On top of caring for their patients, they have a new coworker that they are responsible for. Charge nurses, management, and nurse educators have volunteered to help guide the trainees and catch up on tasks if taking the time to teach causes them to fall behind on their work. This alleviated a lot of that instructor fatigue. During the early stages, the exact goals of the preceptorships were sometimes unclear, and this was an easier problem to solve. We started every preceptorship with a folder that had weekly goals for the preceptee to meet and general goals that needed to be met before the preceptorship ended. Some nurses felt that by limiting most training to one preceptor's tutelage, the new nurse would miss out on the opportunity to learn from multiple professionals. To combat this, we encouraged the preceptors to allow the preceptee to follow other nurses. When an opportunity arose for them to learn a different skill or to experience something out of the norm, the preceptee could follow that separate nurse to gain that extra experience while the preceptor handled medial tasks that they didn't need more experience with at that time. This new form of training gives our new nurses a head start in gaining experience while limiting the risk of them forming unsafe habits. They can perform tasks while a preceptor watches to ensure the safety of the patient is upheld. Retention rates are much higher than in previous years, and more nurses state that they plan on staying in the unit where they were trained. Since the preceptorships have gone so well, we are incorporating this training method into other positions. Also, for the first time at Overland Park Regional Medical Center, LPN positions have been open for the first time, and RN preceptors will be taking them under their tutelage. Charge nurses will now also be precepting new charge nurses. And thanks to this training method, hopefully, this will help us not have less confident nurses in charge due to a lack of trained charge nurses. And that is what I have learned about preceptorships in the hospital scenario. Thanks, guys.